In the sweltering summer of 1892, a 12-year-old boy walked into Cincinnati General Hospital carrying within his body a secret that would challenge everything Victorian medicine understood about human development. What surgeons discovered inside Samuel Hewitt's abdomen was not a tumor, not a cyst, but something far more disturbing: his own twin brother, alive and growing, feeding like a parasite on his blood for over a decade. This is the extraordinary case of Fetus in Fetu, a medical phenomenon so rare and bizarre that it would haunt the nightmares of every physician who witnessed it. The year 1892 marked a pivotal moment in American medicine, caught between the fading superstitions of frontier life and the emerging scientific rigor of the modern age. Cincinnati, Ohio, had transformed from a rough river town into a bustling industrial center, its skyline punctuated by factory smokestacks belching black coal smoke into the humid summer air. The city's general hospital, an imposing four-story brick edifice overlooking the muddy waters of the Ohio River, represented the new American commitment to scientific medicine, though it remained a place where the wealthy went to recover and the poor went to die. The hospital's corridors reeked of carbolic acid, a chemical disinfectant that Dr. Joseph Lister had championed in his crusade against surgical infection. Gas lamps flickered along the walls, casting dancing shadows that seemed to move with malevolent purpose. The operating theaters, located on the building's top floor to maximize natural light, were amphitheater-style rooms where medical students gathered to witness the brutal ballet of 19th-century surgery. In this era, surgery remained a barbaric affair despite recent advances. Anesthesia, though available since the 1840s, was inconsistently administered and poorly understood. Many surgeons still operated in their street clothes, their hands unwashed, believing that a gentleman's hands were inherently clean. The germ theory of disease, proposed by Louis Pasteur and Joseph Lister, was only beginning to gain acceptance among American physicians, many of whom still subscribed to the ancient theory of miasmas, the belief that disease arose from bad air and moral corruption. Rural Ohio in the 1890s remained largely untouched by these medical advances. Farm families like the Hewitts relied on folk remedies passed down through generations: mustard plasters for chest congestion, willow bark tea for fever, and prayer for everything else. Patent medicines filled with alcohol and opium promised miraculous cures, but delivered only temporary relief. When children fell ill, mothers turned first to their worn copies of domestic medical guides, then to the traveling physicians whose horse-drawn wagons appeared sporadically throughout the farming communities. The nearest qualified doctor often lived 50 miles away, accessible only by treacherous dirt roads that became impassable during spring rains and winter snows. Childbirth, broken bones, and serious illnesses were handled by midwives and folk healers, whose knowledge came from experience rather than formal training. It was against this backdrop of medical isolation that young Samuel Hewitt's condition first manifested, though none could have predicted the extraordinary nature of what lay hidden within his growing body. Samuel Hewitt was born on a modest wheat farm outside Lebanon, Ohio, in the spring of 1880, the third child of Martha and Ezekiel Hewitt. His birth had been attended by Mrs. Eleanor Blackthorne, a midwife whose weathered hands had delivered half the children in Warren County. The labor lasted through one long April night, with Martha's cries echoing across the farmyard, while her husband paced the kitchen floor, pausing occasionally to stoke the fire that kept water boiling for the birth. Mrs. Blackthorne noticed nothing unusual about the infant Samuel, save for a slight protrusion in his lower abdomen that she dismissed as a common umbilical hernia. "It'll resolve itself as the boy grows," she assured Martha, wrapping the newborn in a quilt his grandmother had stitched during the long winter months. "I've seen it 100 times before. Nothing to worry your head about." As Samuel grew from infant to toddler to schoolboy, however, the abdominal swelling not only persisted, but gradually enlarged. By his 5th birthday, the mass had grown to the size of a large apple, causing his mother to let out the seams of his clothes repeatedly. By his 8th birthday, it resembled a small melon, drawing curious stares from neighbors at Sunday church services and whispered conversations among the women of the congregation. The boy himself seemed remarkably untroubled by his condition during these early years. He ran through the cornfields with his siblings, helped his father with farm chores, and attended the one-room schoolhouse with the stoic determination expected of farm children. His teacher, Miss Adelaide Thornton, noted in her records that Samuel was a bright child with a particular aptitude for arithmetic, though he sometimes complained of stomach pains that forced him to rest during recess. Martha Hewitt watched her son's condition with growing alarm that she shared only with her husband during their whispered conversations after the children had gone to bed. The Mass seemed to have its own rhythm, pulsing with a beat that was distinct from Samuel's heartbeat. Sometimes, late at night, when she checked on her sleeping children, she could swear she saw movement beneath the boy's nightshirt, a subtle shifting that made her cross herself and whisper prayers for protection against whatever evil might have taken residence in her child's body. The family's financial situation made medical consultation a luxury they could ill afford. Ezekiel Hewitt's wheat crops had suffered through 2 consecutive years of drought, followed by a devastating hailstorm that destroyed most of the 1891 harvest. The family's savings, carefully accumulated over years of frugal living, had dwindled to nothing as they struggled to pay the mortgage on their 160-acre farm. When Samuel's pain intensified dramatically in the summer of 1892, becoming so severe that the boy could no longer help with the harvest, Martha made the agonizing decision to spend their last $20 on a consultation with Dr. Cornelius Blackwood, Cincinnati's most respected surgeon. The journey to Cincinnati required a full day's travel by wagon over rutted dirt roads. Samuel lay in the wagon bed, cushioned by quilts and straw, his distended abdomen making it impossible for him to sit upright for extended periods. Martha sat beside him, bathing his fevered brow with cool water from a mason jar, while Ezekiel guided their old mare through the increasingly heavy traffic as they approached the city. By the time Samuel arrived at Cincinnati General Hospital on July 23, 1892, his condition had deteriorated dramatically. His abdomen had distended to such proportions that he appeared to be carrying a full-term pregnancy, the skin stretched tight and shiny over the enormous mass within. The 12-year-old boy, pale and gaunt from months of poor appetite, walked with the careful, waddling gait of a woman in her final trimester, one hand supporting his swollen belly, the other clutching his mother's calloused fingers. Dr. Cornelius Blackwood was a stern man with steel-grey whiskers and hands that smelled perpetually of carbolic acid and surgical soap. At 58, he had established himself as one of the Midwest's most skilled surgeons, having trained at Harvard Medical School before returning to his native Ohio to practice. His office, located on the hospital's 2nd floor, was lined with medical texts in English, German, and French, along with glass cabinets containing preserved specimens that illustrated the myriad ways the human body could go wrong. Dr. Blackwood had seen his share of medical curiosities during his 30-year career. He had removed tumors the size of cannonballs, extracted foreign objects that defied explanation, including a complete set of silverware from the stomach of a deranged woman, and witnessed the human body's remarkable capacity for both healing and horror. Yet nothing in his extensive experience had prepared him for the case of Samuel Hewitt. The initial examination took place in a cramped consultation room overlooking the hospital's courtyard, where the sounds of horse-drawn ambulances and the cries of street vendors filtered through tall windows. Samuel lay on a narrow examination table, covered with a sheet that had been boiled in carbolic solution, his distended abdomen rising like a small mountain beneath the thin cotton fabric. "Doctor," Blackwood's preliminary palpation revealed a mass that was firm yet yielding, with distinct areas of varying density that suggested a complex internal structure, unlike any tumor he had previously encountered. "Mrs. Hewitt," Dr. Blackwood said, removing his spectacles and cleaning them with deliberate care, his voice carrying the measured authority of a man accustomed to delivering difficult news. "I must be frank with you about your son's condition. What I feel within his abdomen is unlike any tumor I have encountered in 3 decades of practice. The mass appears to have multiple components, areas that feel almost organized, as if they possess their own internal structure. I fear we are dealing with something far more complex than a simple growth." The physician's initial hypothesis centered on a massive ovarian cyst, though the patient's male gender made this diagnosis highly problematic. Teratomas, tumors containing hair, teeth, and other tissue types, had been documented in medical literature, but none of the reported cases approached the size and complexity of Samuel's condition. Dr. Blackwood had read accounts of such growths in the German medical journals, bizarre formations that seemed to mock the normal processes of human development, but he had never expected to encounter one in his own practice. Dr. Blackwood ordered the boy admitted for observation and further examination, though he privately feared that whatever was growing inside the child might be inoperable. The hospital's charity ward was located in the basement, a series of long rooms with barred windows that barely allowed in enough light to distinguish day from night. Samuel was assigned a narrow iron bed in a ward with 15 other patients, men and women, whose various ailments filled the air with a symphony of coughs, groans, and delirious mutterings. Over the following week, Samuel underwent a battery of examinations that represented the cutting edge of 1890s diagnostic medicine. Dr. Blackwood and his colleagues percussed the boy's abdomen with their fingers, listening for the hollow sounds that might indicate fluid or the dull tones that suggested solid masses. They measured the circumference of his belly, 38 inches, larger than many pregnant women at term, and documented the subtle movements that seemed to occur independent of Samuel's breathing or heartbeat. The hospital's newest acquisition, a primitive X-ray machine imported from Germany at considerable expense, proved frustratingly inadequate for imaging the boy's condition. The technology, barely 3 years old following Wilhelm Röntgen's groundbreaking discovery, could reveal bone fractures and foreign objects, but lacked the sophistication to penetrate the complex mass within Samuel's abdomen. The physicians were left to rely on their hands, their experience, and their increasingly troubled intuition about what they might find if they dared to operate. Dr. Morrison, Blackwood's young assistant, suggested consulting with colleagues in Boston and Philadelphia, where some of the country's most advanced medical minds practiced. Telegraph messages were dispatched to Harvard Medical School and the University of Pennsylvania, describing the case in clinical terms that barely hinted at its bizarre nature. The responses, when they came, offered little guidance beyond suggestions for palliative care and expressions of scientific curiosity about the eventual autopsy findings. As the days passed, Samuel's condition deteriorated with alarming rapidity. The mass continued to grow, pressing against his diaphragm and making breathing increasingly difficult. His appetite vanished entirely, and he could manage only small sips of beef broth and water, flavored with a few drops of laudanum to ease his pain. Dark circles appeared beneath his eyes, and his skin took on the waxy pallor that hospital staff had learned to associate with impending death. Martha Hewitt maintained a constant vigil at her son's bedside, sleeping in a wooden chair that the nurses had provided out of sympathy for her plight. She watched helplessly as her boy grew weaker each day, his breathing becoming more labored, his periods of consciousness growing shorter. Other patients in the ward whispered among themselves about the strange case, some crossing themselves when they looked at the boy's grotesquely swollen form. Dr. Blackwood faced an agonizing decision that kept him awake through long summer nights. Surgery in 1892 carried enormous risks, Infection claimed the lives of nearly half of all surgical patients, while hemorrhage and shock accounted for many others. The primitive anesthetic techniques of the era meant that patients often died from the chloroform or ether intended to spare them pain. Yet without intervention, the boy would certainly die as the growing mass compressed his vital organs and slowly strangled his life away. The surgeon spent sleepless nights pacing his study, consulting medical texts and correspondence with colleagues across the country and in Europe, searching for any precedent that might guide his hand. He read accounts of similar cases in the ancient medical literature, descriptions of monsters and prodigies that medieval physicians had attributed to divine punishment or demonic possession. More recent scientific papers offered slightly more rational explanations, but little practical guidance for treatment. On the morning of August 2, 1892, Dr. Blackwood made his decision. Samuel Hewitt would undergo exploratory surgery, despite the considerable risk to his young life. The operation was scheduled for 10 o'clock, when the morning light streaming through the operating theater's skylights would provide optimal visibility for the delicate work ahead. Dr. Blackwood knew that he was venturing into uncharted medical territory where a single mistake could cost not only the boy's life, but his own reputation as well. The operating theater at Cincinnati General Hospital was a circular amphitheater with tiered wooden seating that allowed medical students and visiting physicians to observe procedures from above. The room smelled of carbolic acid, ether, and something else, a metallic scent that seemed to emanate from the surgical instruments themselves. Gas lamps supplemented the natural light, their flames dancing in glass chimneys that cast shifting shadows across the white-tiled walls. The floor sloped slightly toward a central drain, designed to carry away the blood and other fluids that were an inevitable part of surgical practice. Samuel was wheeled into the theater on a narrow gurney, his small form dwarfed by the enormous mass protruding from his abdomen. The boy was conscious, but heavily sedated with laudanum, his eyes glassy and unfocused as he tried to comprehend the strange environment around him. Dr. Blackwood had decided against full anesthesia, fearing that the boy's weakened condition might not survive the additional stress of chloroform or ether. Instead, he planned to rely on local injections of cocaine solution, a new technique that Dr. Karl Koller had pioneered in Vienna just 8 years earlier. The surgical team consisted of Dr. Blackwood, his assistant, Dr. Henry Morrison, and 2 nurses whose primary responsibility was to maintain the sterile field and monitor the patient's vital signs. Above them, in the theater's gallery, sat 23 medical students and 4 visiting physicians, their faces a mixture of professional curiosity and barely concealed horror at what they were about to witness. Among the observers was Dr. William Osler, the renowned physician from Johns Hopkins Hospital, who had traveled to Cincinnati specifically to witness this unprecedented case. Dr. Blackwood began his preparation with the ritualistic washing that had become standard practice since Lister's advocacy of antiseptic surgery. He scrubbed his hands and forearms with carbolic soap until the skin was raw and red, then donned a white canvas apron that had been soaked in carbolic solution. His instruments, scalpels, forceps, retractors, and sutures, had been boiled in carbolic acid and arranged on a sterile tray beside the operating table. The surgeon made his first incision at precisely 10:17 a.m., drawing his scalpel in a long, careful line from Samuel's sternum to his pubic bone. The blade parted skin and subcutaneous tissue with surgical precision, revealing the pale yellow layer of fat beneath. As he deepened the incision, penetrating the fascia and muscle layers, a collective gasp arose from the gallery above. What they saw defied every principle of anatomy they had learned in their medical training. The mass within Samuel's abdomen was not the uniform tumor they had expected. Instead, Dr. Blackwood found himself staring at what appeared to be a grotesque parody of human development, a partially formed fetus, complete with recognizable anatomical features, nestled within a membranous sac that had somehow attached itself to Samuel's blood supply through an intricate network of vessels that pulsed with each beat of the boy's heart. "Dear God in heaven," whispered Dr. Morrison, his usual professional composure shattered by the sight before them. It's a child, a living child." The parasitic twin, for that was what they were witnessing, measured approximately 14 inches in length and weighed nearly 6 pounds. It possessed a clearly defined head with primitive facial features, including eye sockets covered by translucent membranes, a nose with recognizable nostrils, and a mouth lined with small pearl-white teeth that gleamed in the gaslight. Wisps of dark hair covered the scalp, and the limbs, though malformed and incompletely developed, were unmistakably human in structure. Most disturbing of all, the thing appeared to be alive, not conscious in any meaningful sense, but metabolically active, its primitive heart beating in a rhythm that was synchronized with Samuel's own pulse. Dr. Blackwood's hands trembled as he explored the anatomical connections between the twin and its host. A complex network of blood vessels had developed over the 12 years of Samuel's life, allowing the parasitic fetus to draw nutrients and oxygen from its brother's circulatory system. The twin had no functional digestive system of its own, no lungs capable of breathing, no brain capable of thought. It was, in essence, a biological parasite that had been slowly draining its host's life force for over a decade, growing larger and more complex with each passing year. The surgical removal required extraordinary delicacy and precision. Each blood vessel had to be carefully identified, isolated and ligated to prevent hemorrhage, while ensuring that Samuel's own circulation remained intact. Dr. Blackwood worked with the methodical precision of a man defusing a bomb, knowing that a single mistake, a severed artery, a damaged organ, could cost the boy his life. The operation stretched on for nearly 4 hours, with the surgical team working in shifts to maintain their concentration and steady hands. As the parasitic twin was finally separated from its host, a profound silence fell over the operating theater. The thing lay motionless on a surgical tray, its primitive features frozen in an expression that seemed almost peaceful, as if it had finally found the rest that had been denied to it for 12 years. Dr. Blackwood later wrote in his surgical notes that he felt as though he had just performed an execution, ending a life that should never have existed in the first place, yet had somehow persisted through sheer biological determination. Samuel's recovery was nothing short of miraculous by the standards of 1890s medicine. Within hours of the surgery, his breathing improved dramatically as the pressure on his diaphragm was relieved for the first time in years. The boy's first words upon awakening were a request for water, followed by an expression of amazement at how easily he could draw breath. His appetite returned gradually over the following days, and the healthy color began to return to his cheeks as his body no longer had to support the parasitic twin that had been draining his resources. The surgical wound, despite the primitive antiseptic techniques of the era, healed cleanly without signs of infection. Dr. Blackwood attributed this success to the thorough application of Lister's principles and the boy's own remarkable constitution. The incision site was dressed daily with carbolic-soaked bandages, and Samuel was given small doses of morphine to manage the post-operative pain. The boy remained in the hospital for 3 weeks, during which time he became something of a celebrity among the medical staff and a subject of intense scientific interest. Physicians from across the Midwest traveled to Cincinnati to examine him and hear Dr. Blackwood's detailed account of the surgery. Medical journals requested photographs and detailed descriptions of the case, while newspaper reporters sought interviews with the miracle boy who had survived such an extraordinary ordeal. Samuel, for his part, seemed remarkably untroubled by the attention, displaying the resilient spirit that had allowed him to survive 12 years with a parasitic twin feeding on his blood. He spoke little about his experience, preferring to focus on his recovery and his eagerness to return home to his family's farm. The boy showed no signs of psychological trauma from his ordeal, though he did express curiosity about the thing that had been removed from his body. The preserved specimen of the parasitic twin became the centerpiece of Cincinnati General Hospital's pathological collection. Dr. Blackwood carefully placed it in a large glass jar filled with formaldehyde solution, where it would remain for decades as a testament to the bizarre caprice of human development. The specimen was photographed from multiple angles, and detailed drawings were made for inclusion in medical textbooks and journal articles. For years afterward, medical students would gather around the specimen during their pathology rotations, marveling at the grotesque yet fascinating example of developmental biology gone awry. The case was written up in the American Journal of Medicine and became a landmark in the understanding of conjoined twinning and fetal development, cited in medical literature for decades to come. Samuel returned to his family's farm in September 1892, his health fully restored and his future bright with possibility. The boy, who had arrived at the hospital appearing pregnant with his own twin brother, departed as a normal 12-year-old, eager to resume his interrupted childhood. He grew to adulthood, married a local girl named Rebecca Thompson, and raised 4 healthy children of his own, though he rarely spoke of his experience at Cincinnati General Hospital, even to his closest family members. The scar on his abdomen served as a permanent reminder of the brother he never knew he had. A brother who had shared his blood, his nutrients, and his life for 12 years, before finally being laid to rest in the pathology laboratory of a Cincinnati hospital. Samuel lived to the age of 73, dying peacefully in his sleep in 1953, having witnessed the transformation of medicine from the primitive practices of the 1890s to the modern miracles of the mid-20th century. Modern medical science now understands Samuel's condition as fetus in fetu, an extremely rare developmental anomaly that occurs in approximately 1 in 500,000 births. The condition arises when one twin becomes enclosed within the body of the other during early embryonic development, typically between the 4th and 8th weeks of pregnancy, when the neural tube is forming and the basic body plan is being established. The enclosed twin, unable to develop normally due to its abnormal position and limited blood supply, becomes dependent on its host's circulatory system for survival, essentially functioning as a highly complex parasitic organism. Unlike conjoined twins, who share external body parts but maintain separate identities, fetus in fetu represents a complete incorporation of one twin within the other, creating a biological chimera that challenges our understanding of individual identity and development. Contemporary physicians recognize that Dr. Blackwood's surgical intervention was both brilliant and necessary, representing a remarkable achievement for the surgical techniques available in 1892. Without removal, the parasitic twin would have continued to grow, eventually causing fatal compression of Samuel's vital organs. The surgeon's decision to operate, despite the considerable risks involved, demonstrated both medical courage and remarkable surgical skill for an era when such complex procedures were often fatal. The case of Samuel Hewitt also highlights the dramatic advances in prenatal diagnosis that have occurred since 1892. Modern ultrasound technology can detect fetus in fetu during pregnancy, allowing for early intervention and significantly better outcomes. 3-dimensional imaging provides detailed anatomical information that helps surgeons plan their approach, while improved anesthetic techniques and post-operative care have dramatically reduced the risks associated with such complex procedures. Magnetic resonance imaging can now reveal the precise anatomical relationships between the parasitic twin and its host, allowing surgeons to map blood vessels and organ connections before making the first incision. Minimally invasive surgical techniques, including laparoscopic approaches, can sometimes allow for removal of smaller parasitic twins through tiny incisions that heal quickly and leave minimal scarring. Perhaps most significantly, Samuel's case contributed to our understanding of human embryonic development and the delicate processes that determine whether twins develop normally or become locked in a parasitic relationship. The specimen preserved from his surgery provided valuable anatomical information that helped researchers piece together the developmental timeline of this rare condition, contributing to our broader understanding of how genetic and environmental factors influence fetal development. The ethical implications of fetus in fetu cases continue to challenge medical professionals today. Questions arise about the nature of life, consciousness, and medical intervention when dealing with organisms that are genetically human but lack the capacity for independent existence or conscious thought. Samuel's case, occurring in an era when such philosophical considerations were rarely discussed openly in medical circles, nonetheless raised profound questions about the boundaries of human identity and the responsibilities of medical science. Modern bioethicists debate whether parasitic twins should be considered separate individuals or merely abnormal tissue growths, a distinction that has implications for consent, treatment decisions, and the emotional impact on families. The psychological effects on patients who discover they have been carrying a parasitic twin are now recognized as significant, requiring careful counseling and support throughout the treatment process. Samuel Hewitt's extraordinary case reminds us that the human body harbors mysteries that continue to challenge our understanding, even in an age of advanced medical technology and genetic analysis. His story stands as a testament to the resilience of the human spirit and the courage of physicians willing to venture into uncharted medical territory when faced with conditions that defy conventional treatment. The boy who carried his twin brother for 12 years teaches us that survival sometimes requires the most difficult of separations, and that healing can emerge from even the most disturbing of circumstances. In the archives of Cincinnati General Hospital, his case remains a landmark in surgical history, a reminder that medicine's greatest advances often come from confronting the impossible with skill, courage, and an unwavering commitment to preserving human life. Next time, we'll explore a case that challenged Victorian understanding of the human nervous system. A woman whose seizures revealed a truth so shocking that her physicians initially refused to believe their own findings, leading to a discovery that would revolutionize neurology forever. If you found Samuel's journey as compelling as I did, consider subscribing to witness more extraordinary cases from medicine's most mysterious chapters. Each week, we delve deeper into the archives where science meets the supernatural, where human resilience confronts medical impossibility, and where the past whispers its secrets to those brave enough to listen. Until then, remember that within each of us lies the potential for the extraordinary, sometimes beautiful, sometimes terrible, but always profoundly human in its complexity and mystery.